I'm going to finish up talking about wake and sleep cycles by discussing the sleep disorders. I feel like they deserve their own section, and they are, again, really fascinating. And so it's a good place to kind of finish up and see if there are questions maybe on Monday. Whether or not I can answer them, we'll see. But sleep disorders are interesting in and of themselves. Calit distinguishes between nightmares and night terrors, sometimes called sleep terrors. So nightmares we have probably all experienced. We see it more commonly in children. We see it through adolescence sometimes, and in adults sometimes. It gets more and more rare as we get older, but particularly in people who have some kind of psychological disorder, they're more likely to have nightmares than other adults. Nightmares are a symptom of PTSD, so if we have some kind of post-traumatic stress disorder, we can have flashbacks, nightmares, things that are really influenced by that trauma that we are reliving. One of the things that has been suggested, and I put it here because I don't know that it's in the later chapter when we talk about anxiety, but they help people who have PTSD who are having nightmares. One of the things that helps the nightmares is to learn how to do this lucid dreaming. So going to bed thinking about the fact that you are dreaming, so that you start to become aware in your dreams that you are dreaming. I usually have at least one or two students who have had a lot of experience with this, and then a few students who have tried. I worked really hard to do some lucid dreaming when I was younger, and every once in a while I go back into lucid dreaming, but not like I did when I was really. You kind of have to think about it, or at least I do have to think about it. But we distinguished nightmares, which are really more common, and they are occurring during REM sleep. So they are those disjointed dreams that are, and then they're just a nightmare. They just turn into a lot of really disturbing. It's a really disturbing story that we're having a dream about. Night terrors are really different. We see them much more often in children. It's during non-REM sleep, so actually it looks like some transition in those deeper stages of sleep from stage 3 to stage 4. And usually they wake up and they wake up screaming and not able to breathe. They're breathing hard, and they don't remember things. So usually when we wake up from a nightmare, some of my nightmares from when I was a kid, I could still tell you about, but night terrors, they wake up, and if anything's remembered at all, it's really usually just an image. Another sleep disorder is sleepwalking. This is something that, again, occurs more often when we're children, but it can occur as we get older, and especially in adolescence, and a little bit later as especially when we're very stressed, where these people are sleepwalking, and it's during non-REM sleep, so during that slow wave sleep. They're not dreaming, they're not acting out a dream or anything. They get up and they walk around, and as long as they're really not, there's no harm to be done from it unless they start walking out of the house or doing something else, driving or something else while they are sleeping, which sometimes does happen. But sleepwalking itself is not dangerous. It's also not dangerous to wake them and to have them go back to bed, or to pick them up and just get them back in bed. Insomnia is another sleep disorder. There are different ways that we experience insomnia, and as a college student, you have probably experienced insomnia at some point due to just the stress of what you're going through and worrying about things and thinking too much when you're trying to get to sleep at night, or when you wake up in the morning, that there's a lot kind of on your mind. But people with real insomnia, they live with this for more than just some during the stressful times of college. And so we have people who have onset insomnia who have a phase delay in their circadian rhythms. So it's difficult to get to sleep. They actually have a mutation in their PER3 gene. So I actually took out a couple of slides on the PER and TIM proteins and how they influence our circadian rhythms. But these people have a mutation in their PER3 gene, and this is correlated with depression. Insomnia is correlated with several different psychological disorders, and depression being the most sort of the most highly correlated with people who have sleep problems. And it's not that if you have a sleep problem, you're going to have depression. It more looks like if you have depression, you have a sleep problem at some point in your life. So onset insomnia, they can't get to sleep. It's difficult to get to sleep, and they have a phase delay. Versus maintenance insomnia, so these people have what phase advance in their circadian rhythms. So they start to feel really tired at about 7:30 p.m. and they want to go to sleep, but they feel like, and they know that if they do, they're going to wake up at some really early morning hour like 4:30. And so they'll tend to try and push through, but they still tend to wake up very, very early in the morning when most of us would not want to be awake, and they cannot get themselves back to sleep. Finally, sleep apnea is a really different kind of sleep disorder in that it is about the ability to breathe while you're sleeping. And so these people, they often snore quite a bit, and then they'll do this kind of wake themselves up and have multiple awakenings during the night. They're not getting into slow wave sleep. They're not getting their REM sleep. They're not getting the quality sleep that they need. And these multiple awakenings, they're not aware. They usually don't remember waking up during the night. Sleep apnea is correlated with an increased risk of stroke, heart problems, and other disorders. There is some confound there in that one of the causes of sleep apnea is in aging men who are obese, that is correlated with sleep apnea. So there's a lot going on there. However, there are lots of reasons for sleep apnea, and it happens to a lot of different people, and it's based on genetics and hormones and these brain mechanisms that help us to breathe. They are deteriorating as we age. They just tend to deteriorate over time. One of the things they have found that helps, so sometimes every once in a while they do a surgery, but what's much more common is this CPAP, so this continuous positive airway pressure, where they make sure that the person is getting oxygen and is breathing, and they're really pushing air down into their lungs as they sleep. People tend to not like sleeping with this kind of mask and contraption on, but the people I know who have used the CPAP appropriately, they say it changed their lives, that they are getting such a different quality sleep that their lives are just so much richer, because sleep is, as I've said several times now, sleep is very important. The next sleep disorder that I'm going to talk about is narcolepsy, and I am going to put this link in the blue there. There is a really great example of someone who was filming herself do some kind of Japanese martial art, and she has narcolepsy, and so she caught her narcolepsy on film. And I usually don't show the whole thing, but sometimes I do. Narcolepsy is fascinating. If you remember, so you might want to go back to those slides where I talk about orexin or hypocretin, as those are the same things. I'm going to keep calling it orexin. These are people who they're not completely sure why, but it looks like maybe the autoimmune system is attacking those neurons that produce orexin, but they might be attacking the orexin itself. But so if you remember, so if you go back to this and look, orexin is influencing the flip-flop, the on-off of wake-sleep and keeping us awake. It's also influencing the flip-flop of REM, keeping REM sleep off. Okay, so they don't have orexin. And actually, so I'm going to explain the picture below. This is Dr. William Dement. And just so you know, he was one of the early people who looked at the REM rebound effect. And so if you can imagine being woken up by this man every time you go into REM sleep, and his last name is Dement. Okay, it's really funny. He is also, so you see him here with his genetically engineered dogs to have narcolepsy so that he can learn more about narcolepsy and aspects of sleep. He's a really fascinating man, and he has a great last name for this particular field. Anyway, people with narcolepsy, they tend to have sleep attacks. So sleep attacks can, as I think of them, happen in a number of ways. Where at some point I had 2 students in one class who both told me at different times that they had narcolepsy, and they apologize if they fall asleep in class. But sometimes when it's later in the day and things are a little bit slow, they tend to fall asleep. So there's just falling asleep in class, but we all might do that when we're really tired. A sleep attack for narcolepsy can also happen in the situation of being really quite excited. Okay, so I think your author gives the example of someone giving his wedding vows, and he has a sleep attack. So it can be in the middle of something that's really especially emotionally provocative that you get excited about. And not only sleep attacks, but cataplexy. So cataplexy, so that's the on-off. The sleep attack is the on-off of the wake sleep, right? We're not keeping awake. Cataplexy is the on-off of aspects of REM sleep. If you remember, in REM sleep, we are inhibiting activity of those large muscles, of those postural muscles, and that's occurring in the dorsal pons. And that part of our on-off flip-flop of REM, it's not being kept off. And so they can get excited or be involved in something, and suddenly their muscles just go limp. And you'll actually see that if you go and watch this woman with her narcolepsy. And oftentimes they're not completely aware that this has happened, except that they're getting up and they're kind of doing this, what's going on. They also have a sleep paralysis, which, if you don't know what's going on, or if it's happening to you very much, it can be extremely frightening. So, and sleep paralysis is when you are waking up, whether you're kind of falling asleep and you wake up, or you're waking up when you get up in the morning. And again, the dorsal pons is giving the information from the brain to the motor neurons to not let your muscles move. And so you are unable to move. If you don't know what's going on, it's just this extremely scary situation of, I can't move my body and yet I'm awake. And it frightens people. I've had one student at a different time tell me about her sleep paralysis and how scared she was. And I explained this is something that is it's not relatively normal, so to speak, but it makes sense. And I think when you make sense of it, it's less scary. Is it less scary when you make sense of hypnagogic hallucinations? I think so. So I've actually had a few hypnagogic hallucinations. This is when you're, again, well, hypnagogic hallucinations are specifically when you're falling asleep and you have some really disturbing, often, image or hallucination. And in one of my textbooks, one of the people describes this. His ex-roommate, who didn't live with him anymore, walked up to him and stood over him with a knife. And that is exactly very similar to the kind of hypnagogic hallucination I have had. Is it less scary to know what they are? This is, again, you're not in REM sleep yet, but aspects of REM sleep are encroaching on your more aware mind. And it can get really frightening. They often do have this kind of disturbing aspect to the image. For me, knowing what a hypnagogic or hypnopompic hallucination is, the hypnopompic, I think I'm getting that word right, is when we're waking up, is really helpful. I've had a few times had an auditory hallucinations, and thinking maybe that was just a hypnagogic hallucination really helped me a lot to not freak myself out. People with so a lot of us might experience some sleep paralysis. A lot of us might experience hypnagogic or hypnopompic hallucinations, but they experience these more often than, quote, normal people. Distinguishes between periodic limb movement disorder and restless leg syndrome, where periodic limb movement disorder refers to when this is something that's happening when we are asleep and we tend to kick our leg or move our arm, and this tends to happen like every maybe 20 to 30 seconds or so for minutes or hours while we're sleeping. And that's distinguished from restless leg syndrome, where we might feel the urge to kick our leg, and that is happening even when we are awake. Okay, one of the really interesting sleep disorders to me is REM behavior disorder. And this link is to Mike Birbiglia. He is a comedian who talks about his REM behavior disorder. I've actually downloaded and or bought, I guess, his the whole sleepwalk with me in hopes that I could show pieces in class. But this piece in Conan O'Brien is fine, and it works for how he talks about this. People who have REM behavior disorder are acting out their dreams while they are in REM. So that dorsal pons that should be inhibiting those motor movements, it's not doing its job. Interestingly, so to me, this is fascinating. I had no idea. My niece is 35 now, and she just told me that when she is really stressed, and she has been really stressed somewhat lately, she has REM behavior disorder, that she doesn't really seem to know what it's called. And I told her, well, that sounds like REM behavior disorder. When she was in college, she was caught by her roommates sleepwalking a couple times, but it looked like she was actually doing something. But her fiance now has told her several times that she is acting out a dream. It is very dangerous. You're going to see Mike Birbiglia, I think. He tells you that they give him some kind of drug to help him sleep, but it does not really help with the REM behavior disorder. And what they end up doing for him is I guess hopefully just when he's stressed, but he has to sleep in a sleeping bag that is tied up at the neck, and he has mittens on his hands so that he can't untie himself, so that he cannot act out his dreams, because it is extremely dangerous. He has stories of himself going through a second-story window of just like playing football or something. I can't remember what, but you're acting out your dreams. It's very dangerous. So finish up by going to watch The Woman Who Has Narcolepsy, as well as I give you the link for the Conan O'Brien talking to Mike Birbiglia. Watch the end of that. Most of that, it's not really about his sleep disorder. It's about he's really funny, but the end is about his sleep disorder, maybe the last 2 or 3 minutes. Think about questions you have. We'll discuss questions about material as well as the upcoming exam on Monday.